Welcome back, everyone, to OpenLine. Talking about the Partners in Care program, where police officers and clinicians ride with police officers in certain precincts on calls, and it's a new program, and it's one we're kind of just taking a look at. We have with us two people from the mental health cooperative, and I want to just ask, it's in two precincts right now, the North Precinct and the Hermitage Precinct. Why those two? And let's just start with that. Why those two?
Well, what we did, we started by looking at data that the police department had on the number of calls that they were getting for no mental health issues. At
You
the
might
same
be.
time, we looked,
Are you muted? Or am I not hearing?
No.
Oh, go ahead. Okay, I'm sorry.
Can
Go
you hear
ahead.
me?
Yeah, I can hear you now. Go ahead.
Okay.
It was me.
Yeah,
I'm the only one who could not hear you. Everyone else could hear you. So that was completely.
technical difficulties.
Go right ahead.
So we looked at data that the police department had regarding calls that they knew had a mental health component. And then we also looked at data from our crisis team that we operate of calls coming in that had to our crisis line. In Hermitage and North, both had higher rates than some of the other areas in our city. The other reason why we looked at North is the mental health cooperative is located in the heart of the North Precinct. Our crisis treatment center that Michael talked about earlier is right in the heart of North. And a lot of folks who live in some of the boarding homes and halfway houses are in both North as well as in pockets in Hermitage. So the other thing we looked at is the willingness of the commanders and how much they would buy into this in those sectors. And so it was a natural fit, after we came together, looked at the data, talked about the leadership in those areas, that those two precincts were the ones to start. And as we look for expansion, we'll go through the same process as we'll pull the most recent data from the other precincts and make a collective decision about where to expand to next.
This started in June, right? And so what does the initial data show? What surprises you? What kind of stands out?
Well, Amanda can tell you, I was calling, I think, weekly the first couple of months. I was like, this is way busier than I was anticipating. We've gone on about, I think, 841 or 44. I don't have, Amanda has the data sheet in front of her, mental health calls since we launched the program. That first quarter, we went on over 500. That data is just bigger than we were anticipating. All of the city of Denver in 2020 did 2,200 contacts, and we have done over 800 with just the pilot program in about 6 months. So that was surprising. Another surprising thing was about 44% of those turn into full crisis assessments. And when I say that, that means that clinician thought that person might be an imminent danger to themselves or others. That someone might be in a suicidal crisis. They could be experiencing psychosis, which could be hearing hallucinations or voices, or being delusional and putting themselves or others in danger. And then really having to get those people help, which is a much higher percentage than we initially anticipated, and just speaks to the seriousness of the crises that are going on in Nashville.
Wow. How certain are you that this will be expanded? So it's a pilot program. It's in two precincts. It's been going on for 6 months. How likely is it next year it'll be going on in all precincts?
Well, I don't think next year will be in all precincts, but I do think there is a preliminary commitment from the local government, the mayor's office, to expand at least to 2 precincts next year. I would love to say, if they gave the green light, we would be ready to be wide by next fiscal year. But it's up to find the right clinicians, to get all the officers trained. That's going to take us a little bit of time to do it the right way. And that's, to us, that's vitally important. We want to make sure it's done the right way and it's done safely for all those involved, and that we have the right staff in place to do this.
And you feel like then the will is there on the part of, I guess, Metro government. Right now, what might slow it down is you just want to make sure you get the right people and finding the right people who can do this very important work. Is that a fair statement?
Yeah, I think it's finding the right people, and it's and also getting the time to train the officers. Metro Police Department, it's a large police department, and we just recently were been able to hire, or about to hire, a full-time trainer. That's Metro government is funding a training position where we will hire a trainer who will be embedded at the police department to really help us with that lift, because 40 hours of intensive mental health training, we need to be offering one of those classes at least a month for officers. That's a heavy lift. And so we're, that's getting us a step in the right direction to be able to expand it. But certainly personnel and getting everybody trained appropriately and having all of the procedures we need to have in place and everybody understand the common goal. We can't do that overnight.
Fascinating discussion. I thank both of you. Thank you both for coming on. Amanda Brancht, Michael Randolph. Yeah, just a good discussion, an important topic. So thank you for what you're doing, and thanks for coming on.
Thank you for having us.
Thank you.
All right, we will take a break. I'll come back, wrap everything up right after this.